we're now doing microneedling of this patient who has had topical anesthetic applied, and as you can see, this is essentially a painless procedure. And what we're doing is creating little micro channels with fine little needles that penetrate very superficially through the skin into the deeper skin surface. And as it does that, we're going to create small channels in the skin. And this does two things. One is that it's going to stimulate the underlying deep skin called the dermis to generate new collagen and elastic fibers. So just doing that will actually improve the overall texture and the youthful appearance of the skin. And then secondly, what those microchannels will allow us to do is that we have already prepared platelet-rich plasma. Now when we apply the plasma to the skin that now has these small little micro channels to the deep tissue, it will stimulate the skin to regenerate new and healthier skin, because the platelet-rich plasma has multiple cell growth and cell stimulating factors. So this is basically a kind of a two-step process, and has two actually modes of treatment, which is really excellent. So we're doing two things all at once. And as you can see now that there's a kind of a light pinkness to the skin surface. And what that is, and you really can't really see that, but these are little small little micro channels that we've created with the little small micro needles. And that's the concept behind this. And we're going in different directions to make certain that we evenly cover all the skin surface. Okay. So now what we're doing is we're applying a little of the PRP, which is platelet-rich plasma, to all of the skin areas that we've done the microneedling. As I said before, is what we're doing is we're creating these little channels, and as we're applying the PRP, which is platelet-rich plasma that contains multiple cell growth and cell factors, will stimulate the underlying deep dermis. And if you just took PRP without microneedling, it would do absolutely nothing, because it has to penetrate deep into the underlying dermis to stimulate new collagen and new cell and skin growth. So that's what we're doing right now. And you see, she has a nice pinkness to the skin that looks very nice and even. And this is the platelet-rich plasma that we've drawn previously and prepared it with a special tube of centrifugation, and we've now just about covered this area with PRP, which looks good.